Good evening, everyone. My name is Lynn Lazarga. I am the Business Banking Specialist at First Citizens Bank here in Sacramento. I'm so happy and so excited to introduce our next speakers, Dr. Rashiv and Kathy Mesquita. Tonight, we're in for quite a treat. In addition to taking a good look at nutrition and the many health benefits of a plant-based diet, Drs. Rashiv and Kathy Mesquita will also show you how to make a couple of easy vegan dishes right at home. If you downloaded the list and pre-purchased your ingredients, cook along with the demonstration after the talk. Dr. Rashiv Mesquita completed his residency in internal medicine at UC Davis, where he served as the chief resident and was also inducted into the Alpha Omega Alpha Honor Medical Society. He is board certified in internal medicine and lifestyle medicine. He is the past president of the Sierra Sacramento Valley Medical Society, as well as the past chair of Joy of Medicine Committee. He is the medical director of the Lifestyle Medicine Department at the South Sacramento Kaiser Permanente Medical Center. He also authored several articles on the topic and is the principal investigator of 2 ongoing lifestyle clinical trials at Kaiser Permanente: Health Achieved Through Lifestyle Transformation, or HALT, and Resiliency After Cancer, or RACE. He is a certified chef, personal trainer, and yoga instructor. Kathy Mesquita obtained her Doctor of Pharmacy degree at the University of the Pacific and completed the pharmacy practice residency at the University of California, Davis Medical Center. She is board certified in both pharmacotherapy and geriatrics. She earned her Master's of Business Administration from UC Davis Graduate School of Management and has been recognized by the California Society of Health Systems Pharmacists as a fellow. She is the co-author of the cookbook, Healthy Heart, Healthy Planet, along with her husband, Dr. Rashiv Mesquita. Please join me in welcoming Drs. Rashiv and Kathy Mesquita.
Great, thank you so much. Let me see, can you hear me?
Yes.
Okay, great. That's probably going to be one of the most used phrase of this year. Can you hear me? Okay, I'm just gonna try to get my screen on here, and let's see if we can get that. All right, good. Is that visible?
Yes.
Are we good?
Yes,
Okay,
we're good.
perfect. Okay, so thank you so much for that generous introduction, Lynn and Lindsay. And so I'm delighted today to talk about nutrition. This is one of my favorite topics. Many of you who know me know that. And so we're first going to start off with just a primer on plant-based nutrition, how I got into it, why I got into it, and then talk about towards the end some recipes that you can actually prepare in your home. Hopefully you have the ingredients, you're ready to go. We can have some delicious raw doves. You've probably eaten your dinner already. If not to worry, you can eat some of that. Just a disclaimer when we begin, these views and interpretations are my own, do not necessarily represent any particular organization. This is a photo taken in Long Island in New York. I actually grew up in New York, and the fall is really good where the colors come out in the trees. And just as you can see the scenery in this smartphone, my hope is that I can change your internal perspective of nutrition in the world around us, maybe change your point of view so that it reflects the evidence in terms of what's out there. So I'm going to start off by taking you back. It's now about 12 years, almost 13 years. It was around September, the fall, out here in Sacramento, and I was on my way to work actually that day. I just dropped off my boys, who were 1 and 3 years old, at their preschool, and as I was driving to work, I could feel some indigestion in my stomach, and at first I thought maybe it's that Chinese food I had last night, but it seemed to get worse, and then I started feeling some nausea and shortness of breath. I should have probably pulled over, called 911, but I stepped on the gas headed straight to my facility, which was the South Sacramento Kaiser Permanente facility. Managed to stumble to the ER, tap on my friend who was an emergency medicine physician, and tell him, you know, I think I'm having a heart attack. And so so they quickly, okay, it's not here. They quickly rushed me to a gurney and ripped off my clothes and put on the leads. And when they brought the leads to me, showed it to me, it was pretty clear I was having a heart attack. There were the SD elevations, the troponins came back positive. And so I was given the appropriate medicine and then moved to this facility. You're probably very familiar with the cath lab. So the cardiologist performed the cardiac cath, and after it was done said, you know, I have some bad news and good news for you. The bad news is that you have a disease in your left anterior descending artery, but the good news is we were able to put 2 stents into there. And so the 2 stents were put in, and a sandbag was placed in my groin and was shipped up to the hospital. And so I just turned 40 then. And so for me, it was very, you know, it was a shock and a surprise. How could this happen? I was actually in my prime, and I had just been snowboarding not too long ago. I had been elected to the board of directors of my organization. Things were going really well. So I was determined to make sure this didn't happen again. So after I got out of the hospital, I started following the American Heart Association recommendations, which was less than 30% of the calories from fat, fish, a little bit of fish twice a week or so, and fiber, and then reducing the processed meats. I also retained a personal trainer and started working out. And things were going okay until about 3 months later, while at the gym, I was on the treadmill and it was turned up to about 5, and I could feel some chest pressure. And when I turned down to 3, it went away. Turned up to 5, it came back. Turned it down to 3, went away. I said, hey, this is not good. So I went in and I talked to my cardiologist, had a stress test done. It looked like it was positive. So we decided to probably do a stress echo the next week. And they were going to do some other tests. But over the weekend, things sort of deteriorated. I felt some chest pain at rest, called the ambulance, rushed back to the hospital, and a cardiac cath was done. This time the cardiologist, who I really trust, came and did the cardiac cath and then said, you know, I have some bad news and good news. The bad news is that you have major disease and you're going to need bypass surgery. The good news is I have the surgeon right here. And so there's someone waiting there to shake my hand. And then I was rushed into the hospital. And over the course of the weekend, I was prepared for the surgery. This is actually a photo of the operating room. That's the table with the arms on the side. And so the next day I was shipped down to the operating room. Arms were spread out. It's like a cross, it's bound down. Anesthesiologist bowed down over me, and then the lights went out. And when I came to, I realized there was a tube in my mouth. They were trying to extubate me, and a tube in the chest. And after I was extubated, I was determined to make sure this didn't happen again. How could it happen twice? And so I had sutures on my chest, and I was just beginning to learn how to walk, actually. And to me, that once again was a huge surprise because, you know, I was fairly active right before that. And so that began my journey to look to see how we can actually reverse and treat disease better than we are right now, because modern medicine does not reverse this. At best, it delays, but does not reverse. And how can we reverse chronic illness? And that's where I stumbled into plant-based nutrition. When we think about heart attacks, it's quite frequent. Someone has a heart attack every 34 seconds. And every 60 seconds, someone dies from an event related to heart disease. And people may not realize it's the #1 killer in women. And so heart disease is indiscriminate and it's quite present. And then, you know, this led me back to the source of what is the trigger for all this stuff. And the Hippocratic physicians from 5,000 years ago were correct when they said all disease begins in the gut. And it's not just calories. In the last 2 decades, we've been learning more and more about the microbiome. Some of you may be familiar with it. This is the basically universe of bacteria that exist in our colon. And they form the inner lining of the gut. And they are involved in metabolism and producing metabolites that can either harm us or hurt us. And they are also called immunomodulating. They sort of modulate the immune system and are part of our initial defenses. And what we eat actually governs the bacteria in our colon. In fact, you can take a fingerprint of the bacteria in your colon And it's going to be different for someone who's vegan and for someone who's omnivorous, very different. And there are some studies detailed in the New England Journal that even show how these bad pathogens that can actually produce metabolites that increase factors that are more atherogenic. And there's one particular factor called TMAO, trimethylamine oxide. That is actually produced and triggered by bacteria, by metabolites from bacteria in the lining of the colon. It converts TMA to TMAO, and that is actually quite atherogenic. And it's very interesting that those particular pathogenic bacteria are more specific to meat eaters. More on this later. So when I started looking at the food, it was clear there was a difference. You look at the 1950s and you look at now, we're supersizing things. We're eating more calories, more food with high fat content in it. Just over here, you can see the sodas, 4 or 5 times the amount that what we were doing before. And the same with fries and burgers. And then I took a photo of this, and it was in my local supermarket, chocolate covered bacon. I don't know who would find this delicious. Maybe some of you would, but it's interesting to think about what's in there in terms of the fat content, the sugar content, which is just tremendous. But this is what people crave, and this is what's being sold. This is a picture of a restaurant. There's one in Las Vegas and one in Arizona. My father actually sent this to me. He sent me a newspaper clipping of this restaurant called the Heart Attack Grill. So they offer, actually, if you're over 350 pounds, you eat for free. And if you look at the burgers, that's an octuplet burger with 10,000 calories. The maitre d' dressed up as a doctor with a stethoscope, and the waitresses dress up as nurses. And so you think about that, that's and a play with words, it's called the Heart Attack Grill. There are lines out the door for people trying to get in. In fact, there was an article a couple of years ago, which my dad sent me, which actually said that patron Heart Attack Grill dies of heart attack, which is not surprising. So we're consuming more calories and bad calories, high in fat. In fact, we've evolved, if you think about this, from being more active and eating more natural foods to now being more sedentary and eating more fast foods. And it may actually even be more so during the COVID-19 era when we're staying at home and probably activity levels are less and we're resorting to our freezers. So what exactly are we talking about in terms of nutrition? And it's not tonics. By the way, this is a photograph I took from one of our documents in the SSVMS Museum. Just a plug, if any of you haven't seen it, you should go and take a look at it sometime. It's just an amazing place. But it's a photograph of a advertisement in a medical journal of some sort, probably 100 years ago or so. And you can see that potions were sold and there were tonics, and people were looking for something to help them retain their vitality and their health. And that hasn't changed. We still see this desire to look for that magic pill, that magic potion that can actually change things, whether it's a vitamin. But the real answer is there is no simple solution. It requires looking at a balanced approach. One of the preliminary studies that really influenced me was the study by Dean Ornish in the 90s. And this is where he took patients with heart disease and serious heart disease diagnosed by cath. And he basically divided them to 2 camps. One camp had the standard treatment for heart disease at the time with the American Heart Association. And the second group were put on a whole food plant-based diet. And he permitted some non-fat dairy and egg whites, but it was essentially a plant-based diet. Had them do some exercise, some also relaxation with yoga. And then he had them get together in groups. And then when he measured the diameter of the coronary arteries at 1 and 5 years, if you look at the graph, the diameter of the patients who were being treated got bigger. And so the stenosis, or the narrowing, was small. The arteries got bigger, and the ones with the treatment, with the standard treatment, they got smaller. The openings got smaller. So there was a reversal in disease that seemed to continue on to 5 years. And if you can see the control, at 5 years, boom, it gets a lot worse with the standard medical therapy. So to me, that was really eye-opening. Here was a lifestyle effect that could actually cause such a dramatic change that we couldn't achieve with medication. And then not too long after that, there was another physician called Caldwell Esselstyn from the Cleveland Clinic, and he was a surgeon. His locker mate, by the way, was the one who came up with bypass surgery. And Esselstyn was really disenchanted because he, with his conversations with this friend, the surgeon, and also his experience with chronic illness and thyroid disease, he noticed that people kept coming back. It just didn't end. You did a bypass surgery and then someone would come back later, the disease would get worse. So how could you really change that? So he, at the same time, had a similar idea than Ornish and took patients with heart disease, put them on a whole food plant-based diet. This was even stricter than Ornish's. There was no meat at all, no animal protein. And he followed them at 5 and 12 years. And he found that the patients who actually stuck with his plan, the patient who stayed with it, actually had no events and they did okay. And so his was more of a cohort trial, whereas Ornish's was more randomized trial. So to me, that was actually interesting. So here's a very interesting outcome. The one thing he tried to do is he tried to keep the total cholesterol less than 150. So his goal was keeping the total cholesterol less than 150 because he saw that events are reduced after that. So what is actually happening? This is a picture of a blood vessel, and the reddish line that you see is the inner lining, also called the endothelium. And so it's like a carpet that outlines the inner part of the blood vessel. And when there's damage to that, atherosclerosis start to occur and a clot forms. And the whole process, as you can see, is once there's damage, LDL gets sucked in, gets oxidized, turns into a foam cell. And that's like a Darth Vader type cell. It releases inflammatory particles, and then a clot starts forming, a thrombus forms, and it shoots out. And so how can we preserve that endothelium? The goal that Esselstyn and Ornish realized is that if we can preserve that endothelium, then you can actually reverse or stop heart disease. And it's when you have heart disease, that endothelium is almost ablaze as it gets inflamed. And so how do we reduce that? And it appeared that a plant-based nutrition, a plant-based diet seemed to actually do exactly that. What about diabetes? We see that increasing. I'm sure many of you in your practice see more and more of that. So I ran across Dr. Neil Barnard, who works over in Washington, D.C. He actually had done a trial where he took patients with type 2 diabetes and he put them on a plant-based diet. And so to a lot of people, this was heresy because in the old days, we were thinking, okay, diabetics need to go on a low carb diet, and a plant-based diet is actually higher in carbs. But turns out it's actually okay. And he followed them out and he found that there was actually a difference. And it's in the slide over here. You look at it, you can see that the patients who actually were on a plant-based diet, they were actually compared to a American Diabetic Association diet. And the A1C was lower on the patients who were on a plant-based diet as opposed to the American Diabetic Association diet. And he compared it to patients who had medications, those who are not on medications, to take out that medication effect. But either way, it seemed that the A1C drop was better in someone on a plant-based diet, essentially a whole food plant-based diet. And it was a low-fat diet too. What exactly is happening here? So these are pictures of steak that I took at the supermarket. The butcher probably thought I was nuts, but it's a good image for the slides. And it basically, if you look at the slides, you see the little fat stippling in steak, and that's the fat that's spread out in steak. And people like that because it actually makes it tastier. However, that's not good. When you have increased fat in your muscle, it ends up affecting the signaling between insulin and your cells. And that causes glucose intolerance and then type 2 diabetes. And so as we gain weight and we have more fat within our muscles, and we end up interfering with this signaling glucose pathway. So plant-based diet, by reducing weight, can actually also help, among other mechanisms, in improving diabetes. This is a picture I took at Yosemite. I was standing, I wasn't pushing the rock, but standing against it. I had my son take that photo, but just to demonstrate, it was a sort of, this is the way I kind of feel with medicine, and I'm sure many of you do as well. I don't know if you know the myth of Sisyphus, who kept rolling this boulder uphill only to have it roll back down and keep doing it every time. And to me, it seems that the burden of chronic illness is continuing to increase, heart disease and diabetes. And in medicine, it's very hard to stem that flow. With current medication, current treatments, I'm not sure we are going to be able to stem that flow. We have to have another approach because it seems to be increasing with time. So to me, it was a fork in the road. I actually stuck a fork on the ground, the road. There was a fork in the road. I realized my path was changing as I was practicing medicine. I realized maybe there's another way to actually change and help people, not just treat things in a reductionist fashion, but actually reverse their disease and restore their health. Not just put a Band-Aid there and say, okay, this number looks great. A1C looks fine, you're good. Cholesterol looks fine, you're good. But to reverse the disease and restore their health the right way. And so my colleagues and I wrote this article in the Permanente Journal in 2018 on lifestyle medicine, which summarizes some of the salient points on it. Most of these physicians are Permanente medicine physicians. And so we put together all the evidence that supports it. And there is a ton of evidence that supports lifestyle in reducing chronic illness. About 70 to 80% of chronic illness can be affected by lifestyle. And so it is something that we should consider moving forward. And so what actually is a whole food? We often talk about whole foods, but the question is, what exactly is it? So I'm going to take a moment just to define it. So whole foods refers to natural foods, not heavily processed. And they must be unrefined or minimally refined. And then plant-based essentially means foods that come from plants, does not include animal proteins such as meat, milks, eggs, or honey. And then a whole food plant-based diet allows you to meet all your nutritional needs just by using these minimally processed foods. And then it includes fruits, vegetables, pretty much any kind of vegetable, tubers, potatoes, carrots, parsnips, whole grains, cereals, starches, brown rice, millet, even popcorn, and legumes of any kind. So beans, pulses, similar ingredients, all part of that. That would include it. There was actually a article that came out not too long ago. There's so many research articles on plant-based nutrition, in fact, thousands, that I'm not going to cover all of that, but I'm just going to talk about a few that I've noticed more recently that sum up some interesting points. This particular one was published only a month and a half ago, pretty recently, and it shows the association between plant and animal protein intake and overall cause mortality. And to me, that was exciting because it was looking at population benefit. It was a prospective study, which is considered a good study. It included over 200,000 men and almost 200,000 women between 1995 and 2011. And so they looked at food frequency intakes that they had from these patients, and then they looked for mortality at state databases to correlate the two. And what they found, which was interesting, was that a replacement of 3% energy from animal protein with plant protein caused a 10% reduction in mortality in men and women, which is really pretty interesting. Only a 3% change caused a 10%. If you had a vitamin that did that, I think your patients will be running to grab it. 11% overall risk in men and 12% lower risk in women in terms of cardiovascular mortality. So pretty amazing. And that they felt was attributed to substitution of plant for egg and red meat. And so that was interesting. So a 3% reduction in energy. So it's not an all or none effect. There clearly is some leeway. So what about losing weight and weight loss? A lot of folks are looking towards losing weight, especially since obesity is very high in the US. And when you compare studies in terms of which diet is the most effective and most efficient in getting the largest reduction of weight, as you can see over here in this article that was published in 2015, you can see that the largest reduction, which is about 7.7%, was a vegan diet. And then it starts going down. The omnivorous group was about 3.1%. So less than half that benefit, which is pretty amazing. So when we look at other studies, we know that plant-based diet is associated with lower BMI, lower rate of obesity overall. That has been shown. There are also wonderful studies done by the Seventh-day Adventists, and if you have a chance to read them, they really lay it out as to the differences in terms of chronic illness and obesity in vegetarians as compared to non-vegetarians. And why is that? Vegetarians can eat more food by feeling full. They get more food with less fat, less calories, and the fiber fills you up and you get full faster. So it's easier not to consume a lot of calories. And I ran to this article not too long ago. Is there lack of support for whole food plant-based diet in the medical community? And although we know that this is actually an important diet and there's a lot of evidence behind that, why isn't it something that we are actually promoting to our patients? And so the author has some surmises and some thoughts, but the answer is not fully clear. And maybe you might know why that is, but we'll go into some of the possibilities as we go below. I think one part of it also I will add is that, there is no reimbursement for counseling. And in the fee-for-service world, a lot of medicine is in the fee-for-service world. And in the fee-for-service world, you're usually reimbursed when you see someone who has an illness and you're treating that. And so it doesn't reimburse you as well for counseling. And maybe that's starting to change now, but it's an unfortunate circumstance. So that could be part of it. Now, when you look at the food, that could be vegetarian, that could be vegan, but it's not healthy. So that goes back to the definition, whole food plant-based. So that's an important part of it. Well, what about, where do you get the protein, right? That's a common question. Where am I going to get the protein? Am I going to get enough protein? You're probably going to hear that from your patients. And the answer is, of course you will. I have yet to see a vegan or a vegetarian who's protein deficient. It's if you consume enough calories, you'll get as much protein as you need. And we know that looking at the RDA for proteins, and you don't need that much. You can get everything you need if you eat a plant-based diet with enough calories. You can add beans, peas, legumes, tofu. And what about calcium and vitamin D? When we look at calcium and vegetarians, the fracture risk in vegans and vegetarians is very similar to the omnivorous community. And so they seem to be getting enough. You actually get calcium in tofu, mustard, turnip greens, bok choy, kale, and you absorb it a lot better. So you're able to take it in. It's absorbed with, if you have a little citrus with that, it's easier to absorb the calcium. So you can definitely get your calcium needs. Now, vitamin D, of course, comes from the sun. Many people are vitamin D deficient, and they're not necessarily vegetarians. You can be omnivorous too. It's just being in a certain latitude. And so for that, depending on where you are, you may need supplementation, but that's not related to your diet. But what about fiber? Here's another photo I took from our museum, which is just an amazing place for all this. Grant's Hygienic Crackers, a daily regulator. Well, they knew back then, 100 years ago, that fiber was important. But you don't have to get it in a cracker. What is the recommendation of fiber right now? Well, according to the Institute of Medicine that puts out some of these things, for adults, women need 25 grams a day, men need 38 grams a day. And what does the average American adult have? 15 grams a day. So very low. In fact, in some of the other countries outside, they eat much more fiber than we do. And this probably reflects the diet, which is more fast food and more animal-based. And fiber is broken down into soluble and insoluble fiber. So when you look at soluble fiber, we're looking at pears, old-fashioned oats, berries, apples. And then we're looking at insoluble fiber. You can carrots, wheat bran, rice, in fact, brown rice bran there. So both kinds of fiber are actually important to us, and eating a balanced diet will get you everything. What about vitamin B12? So B12, now that's an interesting point here. That's the one thing that you won't get if you're vegan. You can get that if you're omnivorous, but it's not because B12 is made by animals. It's actually made by the bacteria in the animals, they're residing in the animals. So when you eat that, you get B12. But if you're not eating animal products, then we recommend having your B12 level checked periodically to ensure that you're getting the right amount. And you only need a small amount of it, but if you're not consuming it, if you're completely vegan, then you might need supplementation. Now, there are some products that already have it in there, like soy milk and almond milk also already come enriched with that. And so those are some of the ways of getting that. And then also the human body may not absorb B12 as well. And that's something to be aware of. If you have medicines like metformin, or if you have increased acidity, or some people as they age, they may not be able to cleave the area with B12 and the protein and actually absorb it in as well. And so they may need larger amounts of B12, or they may be deficient even if they're not vegan. But so something to keep in mind. But if you are fully plant-based, that's eating no animal products, then maybe that's something you want to check. If you are eating some animal products here and there, you're probably okay. I love this quote by Michael Pollan, who said, "Eat food, not too much, mostly plants." That more or less is the short answer to the supposedly incredibly complicated and confusing question of what we humans should eat in order to be maximally healthy. So, I wanted to throw out some myths here. There are myths out there in diets, and you are probably being bombarded by them because every time you turn around, there's another diet out there, and your patients are probably asking you, maybe you're confused about it. And so it's important that we understand this so we could talk to our patients about it. You've heard of the paleo diet, the ketogenic diet. In fact, I took this photo at this gas station. I went to fill some gas in, and right there, stay keto on the go. Keto approved items inside. So what is that? I mean, is that good for you? Is keto good for you? And so ketogenic diet essentially is a animal protein diet. So it's high in fat. It's basically a high fat animal protein, high fat diet. And so you're maximizing the fat and reducing the carbs, very low carbs, so protein and fat. And so here's an article that looked at all-cause mortality, a systematic review and meta-analysis of observational studies, and it looked at multiple number of studies, 17 studies to be sure. And they found that low-carb diets were associated with a higher risk all-cause mortality overall. So, and all-cause mortality is the important thing to look at. What can cause that? And so clearly that was doing that. And then the American Heart Association put out this trial, low carb diet from animal or plant sources, and then mortality for those who've had an MI. So if you've had a heart attack, you went on a low carb diet, you could go on it on a plant or animal source, and what is the result? And what they found was those who stuck to animal sources had a higher all-cause cardiovascular mortality. And so there was no health benefit with that. And so it's an important thing to remember. You may lose weight now with a low carb diet. Granted, you might lose weight, but you can lose weight with chemotherapy. Doesn't mean that's actually good for you. So we have to look at the overall outcome, the final thing that happens. I've seen patients who triglycerides have shot up to 600-700 on a low carb diet, and it just really affects your lipids. And there are other things that can happen when you eat large quantities of fat. So ultimately, I would defer to the trials and the studies that are done out there, and they should guide our decisions. So what about COVID? You can't help doing a talk without throwing in COVID-19. And so I'd like to touch on it a little bit here. I'd like to bring your attention to this article in the New England Journal in May 21st, just a few months ago. And this was authored by Dr. William Lee. So he is an MD PhD who actually is involved with research on angiogenesis. Angiogenesis refers to the growth of blood vessels sort of sprouting and growing. And he's done a fair amount of work on this area. And so he, in this particular article, he did an autopsy on several patients who had COVID-19 and used electron microscopy to really look down at the cells and see what was going on. And what he found was interesting and remarkable. When COVID-19 strikes, it causes what some people think is this storm, and this cytokine storm, and just all hell breaks loose inside the vasculature. And so what he found was that the COVID-19 seemed to get into the endothelium, actually got into the endothelium and fill it up, like almost like he describes it as a gumball machine, just fills it all up. and then causes a lot of problems there, releases a lot of cytokines. And then there were the things he noticed there were, you know, there was increased thrombosis, so increased clots, a lot of microclots in the blood vessels, and then increased angiogenesis. There were more blood vessels sprouting up and growing. The point that some of these people could be quite hypoxic, but be sitting up. And so what it's doing, in fact, is aging your vasculature inside. So you're years older, maybe 5-10 years old, I don't know, but it's just aging you inside. And it just breaks, it causes havoc on your endothelium. And the question that he brings up, which I think is an interesting question, is, you know, how can you sort of make it so that you are at your best for this? Because you want to be at your best. If your house is going to be on fire, if you're going to get burglarized, you better have your alarm system in gear. You have your sprinkler systems ready to go. If you don't, you're going to be in trouble. And so if you want to prepare that endothelium, then you have to do everything in your power to make sure that your endothelium is in good shape. And we know what helps the endothelium. We know that plant-based nutrition, he's done a lot of research on that and how it impacts the endothelium. Research done by other plant-based researchers as well to show the benefit of plant-based foods on the endothelium and also health. And it's not just that, exercise is also part of that, but diet is a huge role. So to me, that was really interesting, looking into just another approach as to how you can actually prepare to keep yourself in good health, because, you know, we don't have a vaccine yet, and trying to emphasize and strengthen whatever else we can would be up to our benefit. The other thing also of note is that patients with increased fat, this is visceral fat or obesity, are at higher risk, and they seem to do a lot worse with COVID-19. In fact, you know, talking to physicians who take care of patients in the hospital with it, if someone is overweight or obese, they do a lot worse, and we don't know why. It just seems to get worse. And so we do know that plant-based nutrition can help reduce your weight more efficiently than the other diets out there, and also will help reduce not just your overall fat, but also visceral fat. So more reasons to start looking into this as an option. And once again, it's the endothelium and the immune system, keeping your immune system in gear by eating the right foods. And so it's going back to the root cause of disease. So it's diving back to not just being a reductionist by using one treatment for each part of the disease, you know, one treatment to get the A1C down, another treatment to get the blood pressure. Yeah, you can do all that, but let's go back to the root cause and change the root cause so that we can affect all of this. That would be an important point. Love this phrase from William Osler. It says, the young physician starts life with 20 drugs for each disease. The old physician ends life with 1 drug for 12 diseases. And, you know, I'm not saying that we're all old, but certainly lifestyle and nutrition could be important as this one drug. So it's not just about health, it's the health of the planet. We know it takes about 3,000 gallons to grow feed for a cow to make a 1/4 pound of hamburger. So that's, you know, that's consumption of resources, water. And plant-based diet, we know, requires roughly 10 times less energy to produce than animal-based diets. You can see that. You consume much less in terms of fossil fuels or other things to produce plant-based diet as opposed to animal-based. And so something to keep in mind. Plant-based diets also require roughly 100 times less water to produce than animal-based diets. And, you know, we've been through droughts before. Just not watering the lawn may not be enough. Maybe switching to a plant-based diet once a week may make a huge difference. Animal-based diets require roughly several times more land to produce than a plant-based diet. I mean, this, you know, this is actually remarkable if you think about it. So it's just, I mean, as we look at the planet and we see the resources consumed, it may be an interesting thing to keep in mind. The other thing I want to bring to your attention is its effects on cholesterol. Whoops, let me pull this up here. I lost the deck for a second. Yeah, here we go. So in terms of cholesterol, we know that the plant-based diet changes your lipid profile, but how does it change the lipid profile? So I've actually written down my personal cholesterol levels so that you could see that. And 2005, I wasn't on a full plant-based diet. I was partial. This is before my event. So my total cholesterol was actually 180. That is incorrect there. It's not 18, but 180. I just prepared this slide a few minutes before this presentation. And then as you look at 2010, 2017, 2020, total cholesterol went down to 109. So from 180 to 109. And remember, Esselstyn believes that getting that total cholesterol below 150, that's the ceiling that actually was beneficial. LDL cholesterol drops, and that's perfectly fine. The HDL drops, and it's thought to be okay because your HDL becomes more efficient. The thought is that you need fewer of it because now you're much more efficient. And the triglycerides may go up a little bit depending on the kind of carbs you're having. And I think for me it was fruits, eating more fruits. It can vary, it can go up and down a little bit. So I want to bring your attention to this article, The Power of Plants. And this is by Benjamin Ha. He's actually one of my friends who works in Kaiser Permanente in Bakersfield. And he wrote this article in the Permanente Journal last year. And it was really interesting to me. It really struck me when I looked at it. And he first talks about his personal journey through this. And when he started working around the same time I did, likely 20 years ago or so, he had a patient who died of pancreatic cancer. And the patient's wife came to see him a few months later, and she had lost a lot of weight. And she said, he said, are you okay? And she said, yes, I switched my diet to a plant-based diet. And she was, I think, overweight at the time, and she was feeling really good. And she said, why don't you read this book? And she referred him to a book by Joel Fuhrman at the time. And so he changed his diet. He lost weight. He couldn't believe it. And then he started offering it to his patients, and they were reversing their diabetes, reversing their hypertension. And it was really quite remarkable. And so, so he puts forth the argument that this is something we should all be doing as physicians. I'm going to speed through this. That I'm told that I'm running out of time. So this is what we were doing in the past. We know that as doctors, we are actually very impressionable. We can cause change in patients. So if we change our habits, our patients are more likely to change theirs. And in the old days, we probably didn't do it correctly, but now we should reconsider. We know there are a lot of studies that show that the effects and habits of doctors are very powerful. This is a kale farm. It's a picture of a kale garden on top of a hospital, the Ashkenazi hospital system. The CEO, Lisa Harris, had given me a tour there in 2017 when we had done a talk at the American College of Lifestyle Medicine. And she was actually in the Wall Street Journal for this. They're growing this kale on the rooftop, and they're serving it to patients in their clinics and in the pharmacy. So it gives the name pharmacy a whole new meaning, a pharmacy. So let me, we're running out of time. So I'm going to actually scroll down to a bunch of slides here in terms of what it is you can start. You can start substituting with almond milk and soy milk for dairy. Breakfast can be oatmeal. You can also have a tofu scramble, veggie snacks. And then just a final thing, healthcare, if we can look at it, a chronic illness like diabetes, heart disease, and obesity are very much related to the sedentary effects, poor nutrition, and being and actually sleep deprivation, which you just had a talk on that. So if we can improve our lifestyle, we can turn off the tap and reduce what we're seeing as healthcare professionals, because it's very hard to stop it with a reductionist approach. We have to go back to the source and see how we can affect it. I want to thank you all and just show you this quote by Albert Einstein: "Nothing will benefit human health and increase chance of survival of life on Earth as much as evolution to a vegetarian diet." By the way, this is a picture from Yosemite. Took it in Yosemite. We're fortunate in California. Great. I want to thank you all. This is my son scrawling it out on the sand. I want to thank you so much for being a part of this. We're going to shift to the cooking part now. I'm just going to take 2 minutes and restructure my computer in the kitchen. So Lindsay, just give me 2 minutes and I'll be back on.
So I'm going to make some oatmeal raisin scones that actually, I think I developed this recipe back when I was in pharmacy school, and it was something we would throw together when we were studying all the time. I don't know, obviously it was back in the 90s, and fat-free foods was actually pretty much of a fad back then. And so my girlfriends and I cut oil out of everything. And so this is something that kind of goes way back for me. So it's really very simple and it goes together very quickly, especially when you are in a study group. So that's a good thing. The only thing about baking that is important here is we mix the dry ingredients, then we mix the wet ingredients, then we mix them both together, and then we fold in the rest. So it's pretty simple. And I've already measured a few things out, so we'll just go ahead and get started. All right, the first thing here is 1 cup of whole wheat flour. So I'm just gonna dump that into my bowl. And then we've got another cup, and this is just rolled oats. So I'll dump that in as well. The next thing I want is some baking powder. So I'll measure that out. I need, what do I need here? 1.5 teaspoons. So I will grab that. There we go. One more. There we go. And then we'll put in 1/2 teaspoon of cinnamon. Let me grab that. Getting all my dry ingredients in. You know, I didn't put salt in it, but honestly, a little salt's going to bring out the flavor. So I think I'm actually going to maybe put in 1/4 teaspoon. Let me grab that. Maybe. There it is. So just a touch, just to make sure so that it doesn't taste quite so flat, but obviously if you don't want salt, you do not have to add it. Okay, just a little bit. All right, then I'm just gonna mix up my dry ingredients so that it's a nice even mixture. So when I go to mix in my liquids, I don't get any weird clumps. I don't have any of like the baking soda all in one space. It should mix together pretty nicely after that. All right, so the next thing I'm gonna do is add some applesauce, which is kind of my go-to for baking something sweet where I don't wanna use oil. It calls for a third of a cup. One of these is about 1/2 of a cup, so I didn't quite use all of it. I'm notorious for not measuring out everything perfectly. The next thing is some egg replacer. So this is what we do to make it vegan. And I'm going to use 1 tablespoon of this. And I've already measured out 1/4 cup of water. So I'm just going to add it to my water. Then I'll mix it together before I add it to my liquid bowl. So there's that bit. And I'm just going to take a spoon here and mix it up. Again, because I don't want clumps. Almost like, you know, when you're making gravy, you don't want to mix cornstarch with hot water because then you get a bunch of lumps. So we don't want any lumps in this either. All right, I think that works pretty well. Dump that in with the applesauce. Then I'm going to add some soy milk. Make sure I'm not missing anything. Yeah, that's about it. So then I'll mix my wet ingredients together. And then I'll just simply pour my wet ingredients into my dry ingredients. And mix all that up. And I should have mentioned that I already preheated the oven, so it's already up to 400 degrees. And let's see here. It's looking awfully dry today. Oh, it's coming together. I'll show you in a second what it looks like before I stir in the raisins. Kind of like a cookie dough. It's not going to be like a buttery, crumbly scone. It'll be chewier than that, but essentially, right, that's what it looks like. So let me dump in the dough. And we'll get a nice even distribution of those raisins. And that's where really most of the sweetness is going to come from. I don't think, do I have agave nectar in here? I do. Should have added that to the wet ingredients, but you know what? It's really not too late. I'm out of agave nectar, but I do have maple syrup. Technically, you just want something sticky and sweet, so you could use honey too. I'm just going to add that. So it might be a little harder to stir in at this point, but I'm not going to worry about it. All right, so now it'll be a little bit sweeter. And what I did to get ready is I put some nonstick aluminum foil because I'm feeling lazy in terms of cleanup when we're done. So I put that on a baking sheet. And then once I get this all combined, then I'm just going to drop this in about 9 lumps, which is a technical term, I'm sure, to put it on the cookie sheet. And then we're going to bake it for about 10 minutes. So here we go. Get out another spoon. And I'm going to make these as even as possible, but we'll see how that comes out. So just like if you were making drop cookies, it's the same idea. Let me move that so you can actually see what I'm doing. All right, almost done here. All right.
Kathy, what is
Yeah.
the egg replacement that you used?
So I used Bob's Red Mill egg replacer, but I've also used Energy. It just depends on what my store has when I buy it. Those are the only two I've used that are kind of pre-prepared egg replacer, but you can also use ground flaxseed and mix it with water. And I don't remember the ratio off the top of my head, but it's best if you do that and then let it sit for a half an hour or even overnight. It gets very gluey and is a good binding agent, just like these egg replacer products are.
Great, thank you. Just a reminder to everybody still tuning in, if you have any questions for our Iron Chefs, please put them in the chat function and I will read them off as we go along.
All right. I'm just sticking those in the oven and I'm going to set my timer here for 10 minutes. And then I'm going to turn it over to Raj to do his bit and I'm going to get some of this stuff out of the way.
Great.
Another question for you, Kathy. Can you make this gluten-free?
Yeah, you can definitely substitute with a gluten-free flour. So I use whole wheat flour, but there's no reason why you couldn't use besan flour or almond flour or something else. Yeah, totally make them gluten-free very easily.
Great, thank you.
Yeah.
Thank you, Kathy. Kathy's just amazing with that. Is this starting to smell really good from the oven? Maybe you are smelling that as well. So we're going to start now with the no tuna tuna. Hopefully you like this. It's a plant-based apron that actually Kathy made for me. And it says, what does it say? No meat. Are you sure you have enough protein? So anyway, I have the cutting board ready. The first thing we're going to do is we're going to prepare the vegan mayonnaise. So go ahead and grab your food processor. I'm going to grab mine here, put it right here. We'll keep it ready. And then grab your ingredient list. Make sure you have it ready. We're going to start putting things into the food processor here just to prepare the vegan mayonnaise. I washed my hands. Make sure you wash your hands pretty well. You're going to love this, by the way. This is going to be delicious. So the first thing we're going to do is to take tofu. And I'll pull this up here. So hopefully you have your tofu. It comes in blocks like this. It's a firm tofu. I'm just going to actually pour the water out. There was some water in there. And then just drop it in here. Just go ahead and drop the tofu inside. Perfect. Get this out of the way. The next thing, we want to start putting all those ingredients for the vegan mayonnaise in here. 1 teaspoon of apple cider vinegar. Here's my bottle. Open it up. Grab a teaspoon here. There we go. 1 teaspoon of Dijon mustard, and maybe you have your Dijon mustard here that adds a little bit of flavor. We may take a little more time today, but you know, good food comes at a price. I think you're gonna enjoy this. So about one teaspoon of this. You can either use a teaspoon or you could just squirt, probably doesn't matter. Just get enough in there. It uses 1 teaspoon of honey, but instead of honey, I'm gonna substitute a little bit of maple syrup, just a little bit. You could put in some honey if you want. If you want to use raisins, you could do that as well. It's whatever you have. And then also a teaspoon of sea salt. You could use any kind of salt. Sea salt adds a different flavor. You don't have to add the whole teaspoon, by the way. You could use half or a quarter because, you know, if you want to watch, if you have high blood pressure, then I would cut down on the salt. Maybe use half or a quarter teaspoon of salt in there. Next, some white pepper. And I've actually got it ready here. It's 1/8 of a teaspoon of white pepper. Just put that in there. And then a tablespoon of lemon juice. So if you have a lemon, you can cut that and squeeze in a lemon. But for us, time is so important that it's easier if we just buy lemon juice that's already pre-done from the store. Saves time. Go ahead and put a teaspoon in there. Great, looks really good, but we want to add now the soy milk. So I'm just going to take it out of the refrigerator. Here we go. Got some soy milk here, and we're going to add it slowly just to give it that slightly liquid consistency. And we're doing it as a tablespoon. So let me just see. I'm going to open this up here. Since I have a teaspoon, 2.5 teaspoons make a tablespoon. So I'll just put a couple of these. And some of it is eyeballing it just to ensure that it's it gets it a little bit moist. As you put it in, why don't you eyeball it? You don't want it too dry. I just put about a tablespoon's worth, and I'm gonna just blend it a little bit again, see what that looks like. Wow, it's looking good. It's looking good. I'm gonna put a little bit more. So maybe 1.5 tablespoon is what all it required this particular time. Let's blend it one more time. Great, so we have a vegan mayonnaise ready to go. I'm just gonna take it and put it to the side here. And now we're going to prepare the ingredients for the tuna. So go ahead and pull up your recipe sheet. Make sure you have that. First thing is a celery stalk. If you have a celery stalk, go ahead and grab that. I'm going to grab one from the fridge right here. Here we go. Nice celery stalk. I'd rinsed it before, but I'm just going to give it a quick rinse now as well. Great. And then my favorite knife, you should always have a good chef's knife because it does most of the work in the kitchen. I like a Japanese one. It's called Kamekoto. It's really, really good blade. The steel is really pretty good on this, and it's pretty sharp. If a sharp knife is a safe knife, remember, if it's dull, that could be problematic. Just keep moving down. Beautiful little dicing pieces. And I may just rock back and forth on it a little bit to make sure that it's a good consistency. The next thing we want to do is take 2 or 3 pickles. I'm going to use 2 pickles. These are kosher dill pickles. I'm going to grab 2 of them. We'll grab a fork. Here we go. Here's 1. Here's 2. Perfect. I don't know if you can see that from there, but it's fantastic. You see this really amazing diced pieces. So now we're going to put everything together. We have everything ready. I haven't started crying yet. Probably will with the onion. So we're going to take a bowl, and we're going to use this bowl right here. And then we're going to take our chickpeas, and we're going to put our chickpeas in it. Here's 1 can, and we're going to use a second can as well. You can use 2 cans, either 3 cups or 2 cans. Here we go. And so we've got the chickpeas in there. the second thing we're gonna do is we're gonna put some of the onion. Now, this recipe calls for about 2 to 3 tablespoons, but I like onion. I'm gonna put a little bit more on there. And then the celery sticks, the ones you dice, you toss that in there. And we put the, actually before you do anything further, we're gonna take a masher. This is a potato masher, and we're gonna mash everything. This will really mash the garbanzo beans. And we wanna create a little paste. Use both hands. Okay. This takes
Dr. Mesquita, as
are
you're,
there questions? Yeah, please.
yes, as you're mashing,
Yes.
we have a question. Any ideas on yogurts in whole food, plant-based diets?
Yes, yeah. So there are soy yogurts that are out there, you know. You can try them. I've tried some of them, and you know, they're an option. It's if you like fermented foods, then yogurt is one way to get that. But there's also kimchi. I don't know if any of you have had kimchi, but that's another way to get fermented foods. But there are soy yogurts. Hopefully that answers that question. This takes a little bit of time. We're almost there. And you know, that's why cooks have really strong arms. They continue to whip and beat the food. So we're gonna do a shortcut here because these beans are taking a while to really get mashed. So I'm gonna first take the vegan mayonnaise and I'm gonna put it in a bowl. We're gonna do a shortcut. And that's the other thing with cooking. Be prepared to do shortcuts. So I'm gonna take the vegan mayonnaise, put it here. Perfect. And I'm gonna leave a little on because I'm gonna put all of this, all of our garbanzo beans into this food processor. In the interest of time, if we had plenty of time, I would continue to mash with that, but I think it'll take a while. So I'm just gonna put all of this in the food processor. We're gonna save ourselves some time. It's all about efficiency and time. If you have plenty of time, please continue to beat it. So once I put this in here, I'm gonna grab the food processor. I'm gonna put the blade here. Let's get the food processor here. We'll get it in gear. Get it ready. Put the blade inside. Now, remember, I'm only going to pulse it just a few times. We don't want to make it a complete mesh. Let me just mix it up, see what it looks like.
Are you ready for another question, Rajiv?
Yeah, please shoot out questions as I'm doing this.
Is there a concern about estrogens in high soy milk, and tofu diets?
Yeah, so you know, that was actually debunked. The initial thought was that tofu was actually bad for you, but there are so many studies now that say that it's actually good for you. So no, there is no concern anymore. One of my colleagues, Dr. Ernie Bodai, who's a breast surgeon in Permanente, who's written over about 400 or 500 articles and has several patents, has actually published on this, and it's really, there's no worry about it. The issue, of course, is that you should try to have minimally processed tofu and soy if you're going to have it. It should be minimally processed. So this is actually done. It's I got it to a consistency where it's not chunks. I don't want it to be chunks, but at the same time, I don't want it to be fully liquid. Then I'm going to take this vegan mayonnaise, and they say about 1/4 cup or so, but you could eyeball it. Put a little bit in here. I'm going to take this and actually switch it off into my bowl because I want to mix it in a mixing bowl at this point. So I'm going to move the food processor out of the way. And then we're going to take this and put it all in here.
I have another question for you,
Yeah,
Rajiv,
please.
as you're
Please.
stirring.
Yep.
How young should plant-based diets begin? Is this okay to start in children,
Absolutely, yeah,
adolescents?
absolutely. And there are some pediatricians who actually have websites with more information on them. If you go to PCRM, they have a whole thing on pediatrics as well. Yeah, you can start. You know, there are a few things to be aware of, but mostly, yeah. In fact, if you look at countries like India and others, you know, cultures that grow up purely vegetarian. I mean, it's just how they grow up. So
A
you can
follow-up
actually,
question to that.
yeah.
Should they still get animal protein and milk as well?
Well, some of these folks actually get, they drink soy milk, you know, and other alternatives. So you can actually have complete alternatives. You don't necessarily have to have that. I'm just going to put the pickle in here now. And then also the other thing to add, I'm just going to say, is the pepper flakes. There's some pepper. I'm going to add pepper, a little bit of salt, if you wish. And the final thing, just a little bit. And it calls for seaweed flakes. So what I did is I actually took two big sheets of seaweed, and I used a coffee grinder to make these flakes. And you could actually do that, or you could purchase as seaweed flakes. And then I'm just going to spread a little bit of it there. And then mix it, actually. Here we go, just mix it around. I don't know if you're preparing yours, but do you have any questions as you're doing it?
It looks as though most people are asking in the chat function. I think I've gotten to everybody.
Yep. Put a little more vegan mayonnaise. You can put more vegan mayonnaise if you want to make it more damp, and you have to eyeball it. If it looks a little dry, then a little more mayonnaise on it. I wish you were all here because you would be able to taste this. And unless you're making it yourself, if you're making it yourself, you're going to realize how amazing it is. And you know, you're just going to want to eat a lot of it. Okay, so it's done. It's pretty much done. So I'm going to bring it over here so you can see it. Show it to you here. And it basically looks like tuna. I'm going to take a cracker and taste it. Here's a cracker.
Wonderful.
Amazing. Just amazing. The seaweed and the spices just add to the flavor. I mean, it's incredible. I could eat this whole bowl. I'm not going to do that. It's probably not a good thing to do.
Another question for you.
Yeah.
Have you tried it without the seaweed?
You can. You know, I haven't tried without the seaweed, but you can absolutely do that. Yep. You can make any variation you want. You could leave out certain ingredients, leave out the pickles if you wish. You could certainly do that. You could put in raisins if you like to add the sweet flavor. You could leave out the raisins. If you blend it too much, it becomes like hummus. So this is not hummus. This is actually has a consistency of tuna, and actually tastes like it too. It's the seaweed that gives it that flavor. Just want to show you what Kathy prepared. It's actually ready. It smells great. These scones smell amazing, actually. So if you have your scones ready, it's you know, it's a feast. I mean, I feel like I should be eating all this, but I'm not going to do it. It's probably not the right thing to do. But yeah, this mayonnaise, this no tuna is just, I mean, it smells and tastes incredible. Hopefully you have prepared that as well. Are there any other questions?
There's one more question that we have time for. Can you use nuts instead of garbanzo beans?
Well, you can definitely use nuts, and you know, you can actually sprinkle a few nuts in addition if you like. Now nuts, remember, it's mostly fat, like 80% fat. So you don't want to go crazy on the nuts. I mean, I think that's the one thing to be careful of, because there are a lot of calories. There are a ton of calories in nuts. And so you may want to be careful. You can use some, but I wouldn't make it all nuts, because then it's going to be really high density in calories. And if you're looking to lose weight, that's going to be very tricky. But it's a good question. I think adding a few nuts would enhance the flavor. Definitely.